ready for that. Okay, so I'm Pam. I'm one of the inpatient woundoscopy nurses here at Children's. Primarily my role is on the inpatient scene, but we do get lots of consults from Myra, from our urology clinic. So we do what we can to help our patients and families on the inpatient side, but we do consult on the outpatient side as well. So we certainly would love to help you guys while you're at home, in addition to what we do inpatient. So of course, with every presentation, I don't have any relevant financial disclosures to discuss. Throughout the presentation, I may reference a product, and not because I'm getting any financial benefit from that. It just might be a product I'm familiar with, or maybe our families are familiar with. So no other financial disclosures. So I was going to break down the presentation into kind of three different topics. First, we're going to talk about pressure injuries. Second, we're going to talk about moisture-associated skin damage. And then lastly, we'll kind of discuss some resources, what you can do at home, and then I'll field some questions. Okay, so first, pressure injuries. What are they? Pressure injuries might be more commonly known to you as pressure ulcers or bed sores, but why do I want to talk about these? So a lot of times for our spina bifida population, we do see a lot of wounds caused by pressure injuries. The name kind of tells it all. So what are they caused by? So pressure injuries are caused by pressure. I think, years ago, everyone would be like, oh, that's just a bed sore. It's caused, it's because I'm in bed too long. But truly, it's caused by any type of pressure, commonly on a bony prominence. So, your bottom, your sacral, your coccyx area, your elbows, your heels. And it's caused by, that pressure, not just because people are in bed, but you might be sitting down for too long. You might be in bed for too long, or, especially in our pediatric site, in our pediatric population, it can be caused from any kind of medical device. So maybe for anyone that needs help overnight with, CPAP or BiPAP, we do see a lot of pressure injuries caused by the device itself, within your nose or whatnot. So that's a big component of wounds that we see with our spina bifida patients. So pressure can be caused from lots of different things. Commonly, if you're sitting for too long, or in bed for too long, again, on those bony prominence areas, or, sometimes from, again, like a medical device, so something like respiratory related or whatnot. So what can we do about them? So at home, a big piece before we even talk about how do we treat pressure injuries, what can we do to prevent them? And so I can't encourage everyone enough, patients and families, daily skin checks at minimum. If you're out and about, you're sitting in a chair all day, go ahead and check out your skin, whether you have someone to help you do that on your backside, or if you have mirrors, daily skin checks, because, these types of injuries, depending on what kind of perfusion our patients have, they really can develop in not very long at all. So even as little as, 2 hours. So daily skin checks. If you've been in bed all night, go ahead and have someone help check out what your skin did overnight. If you're in a chair all day, go ahead and do those checks after you're out of a chair. If you have any kind of, assistant braces or whatnot that you have, that you wear maybe intermittently throughout the day, go ahead and take a look under those, whether it's a brace or, any kind of extra medical device that you might have to go ahead and assist you, because that's where we see those injuries happen. So what can you do other than skin checks? So offload. So if you're anticipating that you're going to be sitting in your chair all day, go ahead and do what you can to offload and offset that pressure. And so, with that, our rule of thumb is every 15-minute kind of weight shift. So you're sitting in a chair. I feel like I've been sitting here for a while now. Go ahead and kind of relieve that pressure on your bottom. If you are, some of our patients, if you are in bed, more of the day, make sure that you or your caregiver can help you go ahead and reposition at least every 2 hours. Because really the reason why those injuries happen is there's too much pressure on, within that skin, and slowly over time we get tissue ischemia. And with that, we may get some redness, and then it may go ahead and become a partial thickness wound. So just a little bit of that top layer of skin comes off. And then sometimes in no time at all, that becomes a full thickness wound. And then we're dealing with an open wound to muscle and sometimes bone, which is certainly something that we don't want to have to see, and certainly something we want to prevent. So again, what can you do at home? Having people help you offload, turning, pillows. I can't recommend more pillows, the better, to go ahead and kind of hold a position and then reposition and then kind of help you get comfortable. And again, be more mindful of, you know, your bony prominences. So really like those pressure points are your sacral coccygeal areas, you know, elbows, heels, and then your bilateral hips. We call those your ITs. So those are really where that bony kind of interface is going to have a little bit more pressure if you are in those positions. So that's a big piece. What can you do at home and what do we want to check for? So I talk about the daily skin checks. So what's going to be alarming to you? What should you do to then go ahead and intervene? So you do a daily skin check and you see some redness. So that's a great point. Redness on your bottom or redness on a hip. So now you know that you have a little bit of irritation there, and maybe just the beginning of a pressure injury, or you know, maybe not even quite a pressure injury, but you know there's been some kind of compromise there. So that's when you're going to want to offload, get off of that area. If it's been a while since you've, you know, maybe if you are fitted for a wheelchair, if it's been a while, I think it's totally appropriate to keep an eye on that spot. If you think it's not getting better with just the way you're offloading with your weight shifts and whatnot, go ahead and reach out to your DME company that fits you for that chair. I know, again, New Motion is a really common one that we use here at Children. So, you know, reach out to them, see if it's worth getting another fit for that. And your rehab team here might have, you know, a direct reference or contact info for you, but that's kind of, you know, if the pressure is being caused by that chair, it might be worth going ahead to get refit for that. If it's something about if you notice that you're not feeling as well, you're staying in bed longer than you used to, it might be worth you know, calling someone that can help you get fitted for a specialty surface in your home. And so with that might be, you know, call out to your rehab team, or if you already have a surface, calling that company and saying, hey, these are the problems I'm seeing, what else can you offer me? And sometimes I know it's not as easy as just a call in, hey, can you help me? But that's definitely a first step. So go ahead, call, see what resources they can offer you. And then once you know what they can offer you, they'll often tell you, okay, ask your provider for an order for this, or go ahead and reach out to Myra in urology and see if she can get an order from her doc to go ahead and send that over to a company. So, you know, again, kind of, there's lots of resources. It's kind of just figuring out where to call, who to call, and what you can get from home to then kind of figure out what your next steps are. So I want to touch base a little bit about topical treatment. So at home, you know, we already talked about pillows. If you have like a really small skin tear, or just, you know, maybe a blister, or a serous-filled blister, or a superficial wound where maybe just the top layer of skin is off. You know, it's okay. I don't think you need to call a doctor right away. I think it's totally reasonable to keep an eye on it. And what we really like to promote is just a little bit of moisture. So at home, you know, simple Vaseline or Aquaphor, or you know, a little bit of moisture to those superficial wounds, and in combination with offloading, if you think it's caused by pressure, you know, that really can go a long way. So again, I don't think if you see that redness, if you see a little superficial wound, that you need to go, you know, straight to the ER or call your doc. Keep an eye on it. Offload where you can if we think the reason for that injury is because of pressure, and just a simple, a little bit of moisture onto that wound, and, you know, a Band-Aid or a gauze. We really like to promote moisture associated wound healing, because we see that, you know, you can get faster healing of your wound if you have that moisture balance. And in general, we get faster epithelialization to cover that wound if we have just a little bit of added moisture. And really, you know, at home, in my place of home, my kids know there's Aquaphor everywhere, because we see cuts, we see like little road rashes or like rug burns. You know, go ahead and throw that on. It can go a long way. That's certainly something, you know, pretty superficial stuff at home. What can you do? But what about if it's not superficial, if it's a little bit, you know, more serious than that? When should you seek out additional help? So certainly anytime you think there's a sign of infection and, you know, there's a new onset redness or wound that you've noticed. So certainly call your provider for that. You know, fever, soreness, purulent drainage, pussy stuff, definitely call a provider. I kind of talked about, you know, a wound that, you know, you may have noticed from pressure, whether it be from a device or from a bed or from a surface. If you have offloaded, you think that you have gone and kind of taken care of where that pressure was, you feel like you're doing a good job offloading that, and you maybe added a little bit of Aquaphor or Vaseline, and it's getting worse. And I certainly want you to call a provider, because you think maybe you're getting to the root cause of that, but nothing's helping. Definitely call your provider then. Those small superficial wounds, perhaps you can manage them at home with a little bit, but if you have a full thickness wound, when I say full thickness wound, definitely not just the top layer of skin is off, but you're thinking, a little bit more depth, or you might even see some yellow in there. Not necessarily, it's not necessarily pus or purulent drainage, but that yellow stuff, that's no longer viable tissue. So we definitely want maybe a little bit more specialized wound care than just the basics I just talked about. So I think it's really important that you then seek out help from a provider at that point. Maybe you've already seen a provider, you already have a wound care plan because a wound got a little bit bigger or worse, from when you first found it. But what you were using was working, and now it's not. So now your wound is kind of what we say stalling out, or you're just not happy with its progress. If you've used a plan, it was working, it no longer is working, definitely reach out to your provider, because something's going on and you definitely need a little bit more specialized wound care there. And then my next thing is this device related? So a lot of times, our wound care team, our urology team, we start seeing patients, when they're newborns, when they're babies. And, parents and families and patients themselves get really used to, the care that worked when they were a baby. Does it work for them when they're a toddler? Do they need the same devices? But our patients are growing, and I think it's really reasonable to kind of take a step back and think, oh, this chair, maybe it's a chair, or maybe it's a medical, CPAP or BiPAP overnight. You guys grow. So it's totally reasonable that you might start seeing issues because you've grown out of that device. So I think it's really important to kind of think about that and the cause of why you're having this wound, again, if it's a pressure injury, and what can you do about it? So is it time to get refitted for whatever device it is that's causing that, whether it's a respiratory device or whether it's a chair or, a brace or whatnot. I think you really have to be mindful of where you are in life and developing, and if you've grown, or, on the other end, maybe you lost a lot of weight in that year. And maybe that chair you have more bony prominences on your bottom or something. You have a little less cushion than you did a year ago. So I think it's really important to kind of think bigger picture. What can we do topically? What can we do for prevention? And then what do you have at home in terms of the devices that could be causing that? What could, what changes do we need to make? So that's kind of our pressure injury portion of it. I'm going to go right into our moisture-associated skin damage stuff. And then we will certainly have room for questions at the end, okay? So moisture-associated skin damage, what is that and why do I want to talk about it? So moisture-associated skin damage is caused by too much moisture. Too much moisture on our skin will certainly lead to our skin being compromised, and it can lead to open wounds, intertriginous dermatitis, or fungal, even fungal infection. So too much moisture really caused by what and where? It can be caused by a lot of different things. Some of our patients, you might have ostomies, diverting colostomies or urostomies. You may have G-tubes, you may have certain drains, you may have some folds and creases that you now have that you didn't have when you were younger. And so all of these areas are a little at risk for too much moisture. So whether it's a fluid from a drain leaking, or stool leaking from a stoma, or urine leaking from your urinary diversion, it certainly is an area that can have a lot of skin breakdown and some irritation. Also within those creases and folds, sometimes sweat just gets too built up in there, and that can cause a lot of discomfort, some open wounds, and again, even some fungal infections later on. And then for some of our patients, your buttocks are at risk for skin breakdown if you have episodes of incontinence. And so what can we do for that when you guys are at home? So again, with the pressure injuries, we want to protect and prevent. And so for moisture-associated skin damage, we want to prevent. So we always kind of want to protect the skin. So how can we do that? So any kind of skin barrier that you can get your hands on, I'm going to recommend. So for, leaky G-tubes, what are you using at home? Do you have a skin barrier from your DME company, like a clear thin film similar to Catalon or SurePrep? Or are you using, an ointment, whether it's Aquaphor or Desitin or anything with zinc? Certainly if you have a trouble spot, go ahead and kind of think, what can I do to protect my skin? what do you have at home to go ahead and do that? On your, or patients, if you're incontinent, always a skin barrier on your bottom, that's going to go a long way. If you have ostomies, whether it's a urostomy or a colostomy or any kind of diversion like that, what is your baseline skincare? Protection from the beginning is always going to be helpful. And so protect the skin, whether it's, we'll have a little bit more time to talk about the skin barriers itself, the emollients, the creams, and contain that type of leakage. And how do you do that? So our patients, with your ostomies, your urostomies, colostomies, do you have a good pouching system? If you got them when you were being seen at Children's Hospital, hopefully you've met me or some of my teammates, but kind of with the sizing, if you've had those diversions for a long time, does that pouching appliance still work for you? Is it still a good fit? If it's not, certainly you can reach out to your wound ostomy nurses or your DME companies or the companies that you have those appliances from to get different samples to go ahead and try something new. So that's for your ostomies, but what about your leaky G-tubes or PEG tubes? What are you doing for that? Sometimes a gauze or a foam kind of dressing is fine enough to go ahead and contain that drainage, but sometimes it's not. Sometimes you do need a pouching system, so a pouch to go ahead and collect that drainage. If you have those resources at home, because that's something you already have, I always say, go ahead and throw on that. Go ahead and start containing that output to protect the skin. If you don't, that certainly will be a call to your provider because you need a little bit more help than just what a dressing can contain. Any kind of, maybe it's not a super draining tube, but maybe you just have like slow and scan amount of drainage, just a little bit of drainage from there. What can you do to prevent that? You probably don't need a pouching device, but certainly something to absorb that drainage would be good. So a basic skin barrier down and maybe a gauze dressing or a foam dressing. And so when should you seek out additional help? So you have those leaky tubes or leaky sites or too much moisture trapped in a fold or crease. Actually, let's go. So if I talked a lot about the drains and whatnot, but sometimes we do have patients that just get too sweaty within their folds or creases. What can you do at home to go ahead and prevent that type of intertriginous dermatitis, so too much moisture trapped, or anything that could lead to later like fungal components, a fungal infection? Keep that area dry. And so how can you do that? You can do basic powder at home will help promote a drier environment. And with what you have at home, sometimes people do a little bit of powder on like a thin cloth, whether it's a pillowcase or like a dry paper towel, and just get those in those folds and those creases, and that way you're making sure that you're kind of wicking away any kind of moisture that might be trapped there, and you're keeping that area dry. So that's, again, like kind of more home solutions, what you have at home, what can you work with, but when should you seek out additional help? So certainly, again, signs of infection, you feel like it's not getting better despite the interventions that you already know, that you've learned about. And then is it device or product related? So, maybe you just need a little bit more. You have a really leaky site, you don't have the tools at home, and you need to kind of figure out how to get those. And so you can certainly call your provider, and nursing can then go ahead and help fit you for a different product or device, or make different recommendations. For that moisture associated, everything within your folds and creases, again, that's more commonly associated with maybe some fungal infections later down the road. So you certainly might need some topical antifungals or even a systemic antifungal that your provider can then write for. And I think the device, kind of talking about the device and products itself, if it's something that you don't think you necessarily need to see a provider for, but you just need different products, you might need to reach out to your provider and their nurse can help you. But sometimes a lot of these companies, and again, I'm not really supposed to talk about like certain companies, but ostomy companies or catheter related companies or your DME company, a lot of times they do have the power to go ahead and just send samples. I like to promote that because, when we see you in the office and we kind of say, okay, this is the problem, let's try this, that doesn't mean that's going to be your solution for the end of time, right? So I think these companies that can send you samples, it's really important because then you and your family can kind of figure out, okay, you know what, this product worked for me for about 5 years, it no longer does, I'm going to try these samples, find something that's better. Once you trial that out, find a different product that works, whether it be an ostomy device or a different kind of ointment, or again, like a catheter or something like that, they can kind of help gauge what product might be, what maybe it's a different company or something, what might be the best route to then go to. And then you can reach out to your provider with your rehab clinic or urology or whatnot to then go ahead and help you out with your DME monthly order. But there's certainly every patient is different, every wound is different. Normally most solutions, we kind of follow like the same basis. We want to, protect your skin and we want to get to healing, but that looks different for everyone. And, ways that we can go ahead and treat that is going to maybe look different than, your neighbor down the street. And so it's not a one size fits all. It's a lot of trial and error and getting, kind of crafty to kind of see what works best for you as the individual. So kind of just like being mindful of that, using some tools that you have at home, and then figuring out what your next steps are. So I don't know if you guys know this, but it's been all over this month that September is National Preparedness Month. So I was thinking for you at home, for our patients, for our families, what can you use at home to go ahead and help with your, your wound care needs, your simple wound care needs. So try not to talk too much about certain products and, all that stuff. Any kind of gentle cleanser is great for just baseline cleaning. Nothing less is best. So too many products, or too many ingredients in a product, try to stay away from. So your gentle cleansers, Cetaphil, Dove, anything that's pH balanced is great. I talked a little bit about emollients. A little bit of moisture goes a long way for wounds, but also even for protection from friction and shear. So things like Aquaphor, Vaseline. Any kind of non-adherent gauze, I'm going to recommend over an adherent gauze, a standard gauze, just because if you have anything that you want to protect, that non-adherent gauze isn't going to stick to your skin. It's not going to cause trauma later when you take it off. So I think, that's really, really basic wound care. It doesn't have to be super fancy, but a non-adherent gauze is going to go a long way for your little wound care toolkit. We love any kind of skin barriers, whether it's a cream or whether it's a wipe, a film that you can use. I think that if you have any kind of area concern, you're never going to go wrong with putting a skin barrier on, whether it's that wipe or, a zinc cream or whatnot. Pillows and repositioners, again, whether you are, at bed at night, you need something to reposition, so you're getting off those bony prominences, that can go a long way. Or if you are in a wheelchair, that can definitely help out. And I think, it's certainly important to know your primary doctor, their numbers, their nurses' numbers, but I think it's also really nice to have your DME company. Who's your DME company? When are your monthly shipments coming in? If there's any issues with the products you currently get, certainly reach out to them. Say, hey, I didn't get everything I need, or hey, I still have an order for this certain skin barrier, but I want to try something else. And they generally can go ahead and help you out with that. Your medical device companies, that's more, if you have a certain product that is through a certain company, they again have those sampling capabilities that they can send you some samples to go ahead and try out if something's not working. So accredited websites, if you are having any kind of wound care issues, I'm sure you can go down a deep, deep hole of personal stories and what worked for this one patient, what didn't work for this patient, and families. I think that's great for some things, but when you are getting into kind of complications with wound care, I really recommend, look at those accredited websites and what gold standards are for treatment and where to go from there. And, for some of our local patients and families, if you are kind of in a pinch and, you feel like you want to try different products, or you don't have enough products monthly and you need something to kind of bridge the gap, I don't know if I'm just going to tell you a great resource is Good Health Will. It is a medical, it's a medical supply store. There's a few locations locally, and it's all based off of donations. So it's really, it's really cheap, easy to get medical supplies that might just, help you stay out of the ER for the weekend, because you just need some supplies to get you through Monday until you can talk to your doctor or whatnot, or your wound care nurse or urology nurse. So certainly, that is kind of off of my experience with my patients and needs that they may have in terms of wound care. That again, I don't want you just to be having some serious specialty need wound care at home and thinking you can't call anyone, but there's certainly a lot that you can do at home and resources that you have that you can kind of access before calling your provider or going into your standard clinic. So when I got into wound care, I followed a wonderful, wonderful nurse who did this for like 60 years. And she always told me, Pam, there's more than one way to skin a cat. And she's like, I want you to remember that for all your wound and ostomy and continence care. There's a million different ways to do things, and that's okay. And there's lots of different resources to help you do that. So don't think everything is straightforward and you only can, heal your wound one way. That's not the case. There's more than one way to do things, and there's lots of different resources to help you out. So, so that is my presentation for you. I hope that helped. So I think we have time for questions. I don't know. Sorry, everyone, if I went over.
No, we certainly have time for questions. Thank
Okay.
you so much, Pam. That was really informative.
I hope so.
Yeah, Pam, that was fantastic. I can't overemphasize to anyone that has spina bifida, this is the #3 cause of significant issues with patients with spina bifida. So, and it definitely can become a very large issue. So checking your skin is really important. And I think most of the people on the phone call today are adults. Pam, can you talk a little bit about the importance of smoking and wounds and maybe nutrition and wounds? I know it's a big topic that we could spend an hour on, but just maybe a quick refresher.
Sure. Well, I think, for wounds in general, let's see. So if you are a smoker, you should stop. I'm just kidding. No, I'm not kidding. Smoking really is a huge way to decrease your perfusion. And so as we talked about, pressure injuries are caused by, too much pressure, and you're getting, you're losing that perfusion because of that pressure. So in terms of, you're already causing tissue ischemia from the pressure. And so if you add smoking to that, your perfusion already at baseline is not going to be great. So really, I will say most of my experiences with kiddos, so I don't get fielded that question a lot, but I know it's bad. It's not going to be great for wound healing. You're really hurting. You're just, I don't know. Don't smoke, okay? Nutrition. So if you have a wound, you're really going to probably hear a lot of us really say, you definitely have higher caloric needs, especially protein. So we're really going to encourage, higher bouts of protein to go ahead and help with that wound healing. I don't think I answered that very eloquently, but sorry, everyone.
No, that was perfect.
I would say I do a little bit of work with adults in a PRN setting, but you don't want to wind up in a wound care clinic all the time because of vascular issues. And I will say that is definitely the case with our smoker population.
I think Mark was about to ask a question.
I was kind of thinking of adding to that. What Pam just said is nutrition, or you can have a nutritionist here maybe in a future education day, but weight can be such a big factor. Obesity is a big problem in the spina bifida population, and that added weight can add pressure and exacerbate. So something to think about and be conscious of.
Myra, can you think of any questions that you field, maybe from your outpatient population in the clinic about, I don't know, DME questions or supply issues or anything like that?
I really like that you said the option about asking for samples, because that's what I tell everyone as well. I'm like, ask for samples, because like you said, you don't know what works for you until you try it. And just because we give you Coloplast, which is a popular catheter brand, doesn't mean like that's what works best for you.
Sure.
Having their information on hand is always important as well. And I really like the research that you said about like the supplies, because I think that sometimes an issue that we run into. Maybe their DME doesn't carry like the supply that they like, Methylex, so sometimes that's expensive, or they just don't carry it. So I think that supply store, I think, is also a great resource.
And I think to the adults also, I would definitely encourage you to advocate when you think there's a problem, because, you know, pediatrics, it's quite easy to have a young kid come in and you can put them on the table and you can look everywhere. You know, certainly for our adults, it's probably less common that a provider is, and I know I'm guilty of having you get out of your chair and onto a table and looking, you know, full 360 at you. But you know, again, the importance of this whole program is to teach you things. And so certainly advocating for your care to get up and get into the, you know, say like, hey, Dr. Gucci, you need to look at this. And I'd be like, I do need to look at that. And I don't think that that's a problem, because certainly, like I said, it can be a huge problem if it's not treated correctly from the beginning.
Of course, we always want prevention before, you know, prevention first, and then you won't have to do the treatment, right? Any other questions for me?
Courtney, you got any questions?
Well, I think we can go ahead and shift gears. You know, if Pam, if we'll send out, you know, contact and, you know, information about the clinic with the email after this meeting as well. And if you think of any other questions before the end of our time together, certainly you can put them in the chat option and we can pass those along to Pam. But thank you so much for your time.
Sure, thanks for having me.
Yeah, yay. Such an important topic.
Thank you, Pam.
We're gonna shift gears. Mark, I'll let you do your introductions as well, but we have another important topic today that we're gonna hear from Mark about.
Okay. Well, my name is Mark Deschamp. I am an adult with spina bifida, 43 years old. Been in Colorado most of my life. I currently serve on the board for the Spina Bifida Association of Colorado and have since late 2013 or 2014. It's all kind of run together. I don't remember anymore. And I'm past board chair right now for the Spina Bifida Association. And I'm going to be talking, I've been asked to talk about social connectedness. So I'm going to figure out how to share screen. There we go. Now, I don't have a pretty PowerPoint presentation. I didn't think of that. I'm so used to just meeting agendas. So mine is a agenda type thing here. So, so social connectedness, this time of, you know, this, what we're experiencing right now in the country. Let me see. Okay. There's a lot of isolation. I'm sure some people are bored. You know, the stay-at-home orders, etc. And what can manifest from that? We've seen riots, etc. People just kind of, or people refusing to wear masks. They want to get out. You know, it can lead to stress, anxiety, loneliness, depression. Hopefully not suicide, but there's that possibility. And there's a strong connection between mental health and body health, and vice versa. And I'm going to talk about both. Let's see here. There we go. Now I'm going to talk about social networking, and other things, online resources. Now, let's speak this warning that I have on my little guide here, my agenda. Social media, I've seen it where discussions come up and there's disagreements, and it turns nasty. Just really turns nasty. I've seen it with the Spina Bifida group. I hate to see it at all. So I want to emphasize, that there's differences of opinion. Um, it's real. Situations can turn negative. Um, if you can agree to disagree, great. If you can't, move on, get yourself out of that situation because it can negatively affect you mentally, etc. So take yourself away from that. Let's see. Starting with resources, Spina Bifida Association of America and Spina Bifida Association of Colorado. We'll start with Spina Bifida Association of America. They've got resources that I couldn't even put on here. There was just so many for all walks of life, and how to do different things, how to cope with stress, anxiety, depression, teaching independence to kids, teens, teen transition to adulthood, all kinds of things to look at. They just last year came out with the guidelines for care for all ages of people with spina bifida. So from birth to our oldest member here in Colorado is 85 years old. So these guidelines, there's something to think about. I don't know personally, and I don't know past 40 what to expect. So these guidelines are there for me, as well as for myself. My generation is one of the biggest generations in spina bifida, because prior to the 50s, 60s, many people died from it. So there's a huge increase in the number of people, and a lot of doctors and nurses, et cetera, aren't versed in it. So the guidelines have been put together to help people learn and understand and what to expect. So SBU, it's a variety of sources in terms of, or people that have posted different topics. And one of the main things is different ways of exercising, whether it's yoga, meditation, variety of things. Maybe you want to exercise through dance, In addition to these physical things, there comes a social aspect to it. You're not just going to sit there and, do your movements. You're going to talk while you're doing it. So, in addition to that, there are handouts and pamphlets and all kinds of things about different topics. As I said earlier, little thing I couldn't get a picture of. The next item is self-care wheel worksheet. So it's different aspects of life. Pull it up. Pull it up. No, I can't. Yeah. I'll bring it up and I'll keep talking here. The wheel workshop, I'll pull up here in a second. Walk and roll for spina bifida. We can't come together and do those in person. So Spina Bifida Association is put together live streaming events, different fun things to do for all walks of life, as well as speakers about different topics. And they're putting together October 25th, World Spina Bifida Awareness Day. It's an all-day event. Walk and roll for sb.org is the website to see the schedule for the events. And it is a fundraiser, of course, because it's walk and roll for Spina Bifida, but there's some really neat events that are planned for that. So October 25th, all day, walk and roll for sb.org. Spina Bifida of Colorado. What I've tried to work through the last few years as working with the board is utilizing the resources of the Spina Bifida Association of America, and then adding special things for us here in Colorado. And we're doing some really interesting things in terms of groups, specifically for the adults, moms, dads, or parents, caregivers, a group. And then we're also looking at other kids groups, teen groups, but we need a little help to put those together if anybody's interested. But just different meetups virtually right now, but hopefully in person in the near future, just to talk about different topics and meet new people that you haven't met yet, stuff like that. Let's see. The adults with Spina Bifida, that's one that's taking off right now. Two different things that we've got going on is coffee chats twice a month, happy hour twice a month, Saturdays and Wednesdays. Jolene Crasson, one of our adults with Spina Bifida, is putting that, coordinating that. So she has the Zoom links, and her email is there, jnchappy650@gmail.com. As I said, virtual meetups for teens and kids. We're looking for volunteers to help coordinate that. But some of the ideas we've had is doing like little story time on a Saturday morning with the kids and get the teens involved, doing the stories, reading the stories to the kids over Zoom or something like that. So kind of as a respite for the caregivers, parents. Now, other social media groups, Facebook is the one I use. There's so many out there. I'm not going to be a part of them because it'll just blow my mind. So I stick with Facebook groups. Feel free to browse the others. But Facebook, there are myriad of website or Facebook groups out there, all different types. Adults with Spina Bifida, men with Spina Bifida, women only with Spina Bifida, teens with Spina Bifida, professionals, students with Spina Bifida, all of it. So take a look at them. And again, just the rule of thumb I said at the beginning, disagreements are going to come up, but agree to disagree or step away. Excuse me. I spoke earlier about SBU or YOU. Okay. One of the things they have connected to is different individuals with Spina Bifida doing different things to keep active, but socialize with people. And they're doing online yoga. This Hot Wheels Fitness is a good friend of mine. She used to be here in Colorado. Some of you may know Shannon Bevins. She's down now in Central Florida. Her and another adult with Spina Bifida put together a fitness group, and they do online streaming of fitness. You know, take 20 minutes, 30 minutes out of your day, a couple times a week to get in shape and keep your body healthy during these times. Next one is if you want something a little different besides, you know, something doesn't feel like it's working out, but it really is. A friend of mine in Monterey, California, Anya Flatal, she is doing a dance fitness. I don't know where she got this name, but Cat Daddies and Crew Virtual Fitness. And they do, she's certified in UJAM, dance fitness, hip hop type based fitness routines. And all of these are catered to people in Spina Bifida, people in wheelchairs or people with limited mobility. So, I'm sorry I didn't organize this very well. I apologize. Um, number 4, the Colorado Cross Disability Coalition. There's a lot of information about COVID and what it actually is, etc. I encourage you, if you're, you know, the different information, misinformation can be really stressful to look at and to listen to. So get the facts, the real facts of what's going on, to calm your mind in terms of, you know, what's really, am I really susceptible? And that is through the Colorado Cross Disability Coalition. They've got connections to local, state, and federal resources to get the facts, and they have it posted on their website. In addition, they have virtual events that they're doing of all different kinds for advocacy for um, legal preparations, you know, as we age, a variety of topics, and sometimes it's just social hours. So it's another source to look at. These next couple, I'm going to ask Cindy actually to talk a little bit about them, or familiar with the urology, somebody in the urology department talk about the surge group and youth advisory council.
Yeah. So within the pediatric for parents, and then we have a virtual group for children and teenagers. We meet every other month. So we alternate parent group and teen group, and we come together and, you know, parents will share ideas about, you know, best steps for working with schools around catheterization, or strategies to cope with hospital admissions for your child. For the teen group and the child group, we will usually do like a fun activity initially, and then we'll talk about feelings expression or disclosure to your friends, or how to optimize your health. And I'm excited, Mark, to share all of these additional resources with our group. I know they're going to be really thrilled about those things. Also through Children's, there are different ways to get involved in the hospital, like a youth advisory board or youth advisory council, where they can, patients that have at our hospital can give feedback to the hospital to make it a more appealing place to come, and maybe make it feel more welcoming to patients and families. And I'm the good contact for those things, so we'll make sure we include that in the when we send out your sheet.
Okay. That's good. Now, a lot of activities have been canceled, camps, etc., but they haven't completely shut, or they're starting to reopen, I should say. Roundup River Ranch, many of you may have heard of. Easter Seals has been around for God knows how many years here in Colorado. Adaptive Adventures, National Sports Center for the Disabled, or NSCD. They're all active. They're all doing something for us, something for the disabled community. Easter Seals, their camp is open, not for camps, but you can rent out cabins. Families can rent out cabins. Some of the activities, like going up the boardwalk, using the fishing ponds, or going to the fishing ponds, that's all available. Unfortunately, sad to say, the horseback riding and stuff is not open, but it's a nice place to go up to Empire, get out of town, and take a day or two, you know, and just recharge and, you know, nature. They've also got many programs going on that I couldn't put on here. So I would encourage you, easterseals.com/CO is the Colorado page. All of the different programs they have, day programs, you know, and different age groups, etc. that they've got going on virtually and maybe in person. Next, Adaptive Adventures. They have an events page. They're doing a lot of virtual fitness stuff, um, uh, virtual just meetups and talks that they're doing. Unfortunately, they can't do a lot of their programs. I don't know. I didn't find if they were doing. They used to let you borrow some of their equipment for a day or two, their adaptive bikes, etc. I didn't see anything where they were allowing that to happen, but maybe you'll find it. National Sports Center for Disabled has virtual programming, and again, just like Easter Seals and all these other sources, there were just a number of different programs that were going on that I couldn't put them all on here. So I would encourage you to take a look at their website, nscd.org. Under programs, virtual programming, it's the last option there. Lots of stuff going on. So, and two other things, Staunton State Park, a good way to refresh and to energize yourself is to get out in nature. Couple of recommendations I have is I go down to Chatfield State Park, the dog park. It's very well paved, 80 acres. Let the dog run around and you can get around in a wheelchair. I'm a full-time wheelchair user quite easily. We go, my dog and I, hour and a half, walk around, or an hour. Wears her out, wears me out. It's good exercise. Staunton State Park, though, they have a neat little 1,200 acre, used to be a farm, a ranch for this family, Staunton family. They donated it. It's now an open space area, Colorado State Park. You can rent what's called a track chair. It is a tank treaded wheelchair, power chair that you can take around their park, certain trails, 3 or 4 different trails that they have. And you can borrow it and go around through the park. It's really a cool program, really a neat chair. Something fun to do. So, last one, Chanda Center for Health. As I spoke earlier about the mind and body connection, and under stressful situations is thinking about both the health of both mind and body. Chanda Center for Health does that, thinks about both. They do yoga sessions, but they also do acupuncture, primary care they've come up with, but they do alternative therapies, acupuncture, chiropractic, massage, and as I say, their personal recommendation, 20, just a little quick story, 2018, when I was part of the Spina Bifida Association, we had a little bit of a legal matter that came up, civil matter, that being board chair at the time, it was very, very stressful for me. Did not realize how detrimental it had become for my health. So having heard about Chanda Center, I thought, what the heck, let's try it out, see if it might, help me. I didn't realize how much of a mind-body connection there was until getting into that program. They do behavioral health, just everything, and it's really a neat, a neat program. So I encourage you to look at it, look into it. So, and that is everything I had. I apologize. Don't do these very often, so
That was wonderful. Oh,
thank you.
Thank you so much for compiling all those amazing resources. I am,